So talking about hypertension today, it's very important to know what high blood pressure and hypertension means. High blood pressure is something where just the blood pressure goes up. Maybe it's once, whenever you check it, very dependent on what you're doing, whereas hypertension is more of a diagnosis where it is chronic elevation of your blood pressure. What does it mean to have hypertension? So there are two numbers that we always have to understand, and I really want our patients to know what each means. The systolic blood pressure is the top number, which is what shows how much pressure your heart is pumping against. The blood that hits the arteries, what pressure is it pumping against? So a lot of times we think that it's only based on how heavy the heart is pumping, but it also depends on how the arteries are, the status of the arteries. As we get older, our arteries get stiffer, so obviously our top number is higher. Diastolic blood pressure, it is what measures the heart function when it's relaxing, and that is the bottom number. Typically, like I said, the blood pressure varies. It changes with age. There's a lot of familial or genetic predisposition to high blood pressure. There's also our lifestyle. High salt intake, high stress, less sleep, poor sleep habits, eating out a lot, high alcohol intake, all those cause a change in blood pressure. Back in the day, we always thought that the top number, which is the systolic blood pressure, was the only most important factor to determine whether you can have a stroke or heart attack. But we've realized with research over the years that both numbers are just as important. Yes, the top number is very important, but even the bottom number is important as well. Normal blood pressure we usually take as a range of 120 over 80. The younger you are, we expect your blood pressure to be in the 110 to 120s, over 60 to 80s. And by young, I mean if you're less than 30 years old. But when we start getting older, like I said, multiple factors change the blood pressure readings. So ideal blood pressure for us is 120 to 130 on the top and 60 to 80 on the bottom. Now, what is stage 1 hypertension? You always hear your doctors saying, oh, you have mildly elevated blood pressure, stage 1 blood pressure, stage 2 blood pressure. What stage 1 is when your top number is mildly elevated, between 120 to 130s, or a little bit higher, which is 130 to 140. And the bottom number is 80 to 89. And stage 2 is when it is 140 or above, and the bottom number is 90 or above. Standard guidelines and national guidelines are very variable. The American Heart Association has come up with varying guidelines every few years based on study data and the impact the blood pressure has on stroke, heart disease, heart failure, many factors. But the usual national guidelines and our goals are to keep our blood pressure down less than 140 over 90, ideally between 120 to 130s, over 80 to 89. So whenever you see your doctors managing your blood pressure or changing your medications, that is the goal that they're trying to hit. What are the other factors that can cause high blood pressure? Like I said, lifestyle changes. One big factor that we forget is sleep apnea. So if you have blood pressure that suddenly starts rising, and there are other factors such as obesity, and you don't know what the cause of the blood pressure is, or it's not coming down, or you're needing multiple medications, please do talk to your doctor. Talk to them about your sleep habits, because there can be underlying sleep apnea, which untreated can cause to other significant health problems, not just hypertension, but even heart failure. The other things that we look at, especially high blood pressure in younger adults, we always want to rule out, factors such as adrenal tumors, adrenal gland changes, kidney cysts. There are some conditions called polycystic kidney disease that, multiple cysts in the kidneys that can change the blood pressure. You have stenosis or blockage of the artery supplying blood to the kidneys, which raises the pressures in the kidneys, and kidneys play such an important role in blood pressure control. It's not just at the end stage, but it is much early on that we want to make sure that these are not one of the causes. How do you bring blood pressure down? First and foremost is to change your lifestyle. you have regular exercise. Now, how does regular exercise help? When you're working out, your blood vessels actually have to supply a lot more blood to the tissues, which means that they relax and there's increased blood flow, which is why right after you exercise, you feel like your blood pressure is dropping. That's the reason why regular routine cardiac exercise, whether that be between brisk walking, running, whatever suits you, which safe exercise, should help bring the pressure down. Cutting down on salt intake, cutting down on processed foods, cutting down on alcohol intake, all those do help. Unfortunately, genetic causes we cannot change, which is why a routine check with your physician, whether it be an annual wellness check or repeat follow-ups, for all other causes, make sure that they check your blood pressure and monitor and keep it within goal. And if it is consistently elevated, then they will use medications to bring it down. Now, what medications can be used? I get this question all the time. How do you decide? Well, it depends on multiple factors. It depends also on your comorbid conditions, meaning other conditions that you have, like diabetes. We pick medications that will protect your kidneys as well as bring blood pressure down. Heart failure, a history of stroke, heart disease, all of these factors, and in fact, even ethnicity. There are some meds that work better in African Americans than they work in Caucasians or in Indians. There are, different meds that we can use, and that's where whether your primary care doctor, your cardiologist, whoever is on board can help address this.